Welcome everybody to today's listening session on the NBDPN guidelines revision. I am Nina Forestieri, and I'm the vice chair on the board of directors, as well as I manage the North Carolina Birth Effects Monitoring Program. And helping me facilitate this session today are Amanda St. Louis from New York, who is the Surveillance Guidelines and Standards Committee chair, and also Washa Leo from Massachusetts, who will be helping to lead this guidelines revision work group. So before we kind of jump into the discussion, I'll pass it over to Washa to give a really brief introduction on the guidelines. Hopefully you all are familiar with our guidelines manual. So we'll just give a really brief introduction and then also go over the survey questions that were sent out earlier this year. And then Amanda will do a quick high-level overview of the results of that survey. And then after that, we'll jump into some discussion. So I will hand it over to Washa.
Thank you, Nina. And also thank you for the opportunity to have me on board for such important work. The NBDPN guideline is an important document. It provides guidance to the state and other population-based birth defect surveillance program to develop, plan, implement, and conduct birth defect surveillance and research. So the first version of the guideline came out in 2004, 6 more years after NBDPN was created in 1997. And I get this, there were 2 chapters in the first version. So a more chapter had been added and then revised over the years. So now there are 12 chapters in the guideline, cover a wide range of issues related to birth defect surveillance and research. So however, some information is kind of out of date or overlapping. So the NBDPN board have decided to conduct a full and thorough revision of the guideline to streamline and also integrate the chapters with more up-to-date information. So the group began meeting in the fall of 2022, and will facilitate the revision. And a survey was sent to NBDPN mailing list for feedback in the January and February this year. So next slide, yeah. So the survey asked a series of questions such as what have you used the guidelines for? And how often do you use the guideline, and which chapter have you used? And then once the respondents select the chapters, and several chapter specific questions will come up and asking, should we keep the information in this section, and what would make this section better? And please include any internal, external resources that you believe should be linked to. And is there anything else you would like to say about this section? And then follow the chapter specific question. There's also more open question as do you have any additional suggestion for the topic to include? And do you have any suggestion for increasing the utility for the guidelines, and any other suggestion or guideline for revisions? So we correct all those answers in March, and the analytic team analyzed the responses. So now I pass to Amanda, the lead of this surveillance analytic team, to present the high-level summary of the survey results. So now,
thank you.
To you.
Thank you, Washa. There were 55 survey participants representing 32 states. Many respondents had more than one role, with the most frequent role being data collector or abstractor, followed by program manager, epidemiologist, other, data manager, then clinician. Next slide. Respondents often use the guidelines for more than one reason. Most frequently, that was for informing or enhancing surveillance practices, followed by decision-making, creating state-specific guidelines, informing or establishing policy, then other. Those that did not use the guidelines either did not know about them, found it not relevant to their job function, or their state already has established guidelines. Over 50% of respondents use the guidelines a few times a year, 22% use them annually or less often, 17% use them weekly or daily, and 5% never use them. The most commonly used chapter was Chapter 3, Case Definition, followed by Chapter 5, Classification and Coding, Chapter 6, Case Ascertainment Methods, Chapter 4, Data Variables, Chapter 7, Data Quality Management, and others. The least commonly used chapters were Chapter 2, Legislation, and Chapter 11, Data Presentation. Respondents suggested keeping the information in the majority of the sections, with some people indicating we could remove information from Chapter 2, Legislation, Chapter 5, Classification and Coding, Chapter 8, Statistical Methods, Chapter 9, Data Management and Security, Chapter 10, Data Collaboration and Dissemination through the NBDPN, and Chapter 11, Legislation. We also asked respondents about the usefulness of each chapter, with all chapters being very useful to at least two respondents. The most consistently useful chapters were Chapter 3, Case Definition, Chapter 5, Classification and Coding, and Chapter 6, Case Ascertainment Methods. Most of the other chapters had at least one respondent scoring that they were not useful. On the right side of the slide, you can see the average usefulness rating by chapter and 95% confidence interval. And if anyone is interested, we do have the slides available. In summary, most respondents agreed that contents from each chapter should be kept and revised. The top three most useful chapters were Chapter 3, Case Definition, Chapter 5, Classification and Coding, and Chapter 6, Case Ascertainment Methods. The least useful chapters were Chapter 2, Legislation, Chapter 10, Data Collaboration and Dissemination, and Chapter 11, Data Presentation. Open-ended feedback called for more integrated, concise, and streamlined up-to-date information, including considerations for active and passive systems, as well as less text and more tables and visuals. This slide shows you an outline of the chapters we propose for the new manual and the chapters from the old manual that will be referenced or combined. Each chapter will include 1 to 3 chapters from the old manual. The tentative outline is to have Chapter 1 be a background, Chapter 2, defining the purpose and objectives of your population-based birth defect surveillance, Chapter 3, program design and infrastructure, Chapter 4, data criteria and classification, Chapter 5, methodology for case ascertainment, Chapter 6, quality assurance, and Chapter 7, data utilization. Nina, do you have anything that you'd like to add to this slide before transitioning to the discussion questions?
I don't think so. I will just note that, it's a proposed outline, so not set in stone, and we're still kind of going through the process of getting feedback, and that's what this session will hopefully help us to do as well, so that we can formulate the new guidelines to be hopefully more user-friendly and then a little leaner and meaner, we like to say. So more concise, more kind of condensed, with hopefully the information that is most used and useful to you all. So I will kind of go through our discussion questions now, and these were sent out ahead of time. So hopefully folks had a little bit of time beforehand to look at these. And we'll start, if I can get my slides to move, there we go. So we included some of the questions from the survey as well, just because there was limited space within the survey to type those open-ended questions. I think there was a pretty brief character limit there. So we wanted to include those questions from the survey as well as a few additional questions. So first of all, we just want to know, what do you and or your program use the guidelines for? And this was a question in the survey, and over on the right side of the slide, I've put in some of the responses that we received within that survey. But given these are brief responses, I would love to hear more from you all about how you use the guidelines. So feel free to either raise your hand or come off mute or use the chat. And Amanda, if you could kind of help me monitor the chat and any hand raising, that would be great.
I'm not seeing any raised yet, so I'll just chime in to get conversation moving. Here in New York State, we often reference Chapter 3 of the guidelines, mostly the appendix that details the different birth defects and exclusion and inclusion criteria. We'll check there whenever we're making coding decisions for new language or defects that we're less familiar with.
Do others have uses for the guidelines? So we've got a few things noted here, but again, these are brief responses. So we know the case definitions are a popular section and coding. Also, basic statistical methods. I think that may have been mentioned in some capacity a couple of times. Information about data collection, standards, people use them for standards development and that sort of thing. Are there other things that you all use the guidelines for, or do you find that kind of these responses are reflected in how you use the guidelines too?
This is Jerusha from Georgia. I'd say a lot of our uses for the guidelines are reflected here, especially bringing new people into the fold, briefing them on how we do case ascertainment, what the different possibilities and sources are, as well as in general, the variables we'd consider of interest to our collection. And of course, Chapter 3 is definitely the biggest utility for us.
Great. Yeah, it does seem like a lot of folks like to use this. And I know we do in my state as well, as a component of kind of training new staff, because there's so much comprehensive information in there. So we do find sometimes that stuff is out of date, which is why we're going through this process. But it is good to know that others are using the guidelines for those purposes too.
And there are a couple comments in the chat.
Great. See, so it looks like Holly in Indiana said that they have state-specific guidelines, but use case definitions and inclusion criteria to help formulate their guidelines, and also refer to the guidelines for NBDPN reporting. Anna in Maine says that responses are reflected in kind of their state's use. Nyla, let's see, uses case definitions and inclusion criteria. And then Liz in Michigan noted that the Chapter 7 data quality management has recently been used by Michigan as they do more work in developing their new birth defects registry. So the timeliness, completeness, and accuracy aspects of data quality and standards, which is great. So I'll jump around a little bit because I saw a note about state-specific guidelines in here. Do other states, let's see, so it looks like in Indiana, they have state-specific guidelines. Do other states represented on this call have state-specific guidelines?
Yeah, Massachusetts have our specific guideline, and we cover quite a lot more defect than NBDPN recommended.
Mm-hmm. And do you know, Washa, if your state's guidelines incorporate some of the NBDPN guidelines, or if they're totally separate?
Yeah, we'll be include some kind of component. But there's a lot of overlapping.
Yeah.
Yeah.
And I see in the chat, Anna in Maine noted, I've used most of the guidelines at one time or another, especially when first starting, yes. But now use mainly chapters 3 and 4, which I think was pretty common in the survey responses that we got too. And Jody noted Illinois has their own guidelines, but also referenced the NBDPN guidelines for further clarification or questionable decisions. Anyone else?
Hi, this is Michelle from Minnesota, and we do have Minnesota state guidelines that really overlap national birth defects as well.
Great. And do you know if those guidelines were based in part on the network guidelines or totally separate?
A lot of overlapping.
Yeah.
Yeah, they were from the network. Yeah.
Great. Let's see. And then see in the chat, Russ Kirby noted Florida developed specific protocols for each project, and they have one for overall birth defect surveillance and specific ones for NAS, Zika, stillbirth, etc. All based on NBDPN guidelines, but made specific for our program. That's interesting. Let's see. So it seems like a lot of alignment with NBDPN guidelines when states do have their own. And so, yeah, and a lot of surveillance built using these guidelines. So that's helpful to see. It's also helpful to know what states have their own guidelines that we could maybe reach out to as we're building these, because we don't necessarily, if states have been updating their own guidelines in a way, that might give us some ideas for what would be most useful for ours as well.
This is Carol from Colorado.
Yeah.
During my years working for the Colorado's program, I used the guidelines a lot, except that because Colorado was mainly a passive surveillance system, there was always the understanding that we had to do what we could. And so we could only use the guidelines up to a certain point because our reality was we're passive. So that may be something that we need to consider when we're revising the guidelines as well.
Yes.
This really happened with coding. and the fact that you receive case reports possibly in a coded format and you're kind of stuck. But anyway, it's the reason why we need to revise the guidelines.
Yes. Yeah, that's a very good point, and something that was also kind of reflected throughout the survey responses. People noted just wanting to have more, passive and active guidance embedded in those. So yes, that will certainly be something that we take into consideration. And so it sounds like people are kind of moving towards this other question of, is there anything you would like to use the guidelines for that currently isn't covered? And I've seen a couple things in the chat too. So Rebecca Lieberman noted, how about adding something on how to monitor for distinguishing true changes in birth defects prevalence versus random year-to-year variation? Yes, that is a great suggestion. And then let's see. So South Carolina has state-specific guidelines and follows NBDPN. And then it also looks like New Jersey has specific guidelines, which are more in depth with more diagnoses and some overlap with NBDPN too. So that seems to be a theme, is a lot of overlap with the network. So definitely something we'll want to think about when we go to revise, just knowing that other states are going to use these or have used these as the basis for their own guidelines too. All right, is there anything else that you feel like you wish you could use the guidelines for that's not currently covered? I know some of that, some passive processes may not be covered as well in the guidelines. So that's certainly one thing. Is there anything else? Let's see, yeah, better classification between active versus passive with case ascertainment. So Jody noted more programs are trying to become active, but the guidelines aren't clear as to requirements, which is confusing for many programs. So yes, yeah, more clarification on what exactly that means might be helpful. But also those definitions might look a little different now than they did when these guidelines were first written. Now that we have more kind of, some places are moving toward interoperability and things like that. And so that will make things look a little different, and also isn't something that is really covered in the existing guidelines. So that would be another thing too. But anything else?
And kind of related to that, maybe like how to transition from passive to active, or add like active components. And another topic that has come up, but I'm not sure if I've heard it here today yet, is prenatal reporting and just learning more about the best practices with collecting prenatal data from like the NBDPN perspective.
Yeah. That's a good point too. Any other thoughts on these first few questions? I see a yes, more about prenatal reporting in the chat. I agree. All right, so I'll move on to the next few questions we had. If I can get my slides to move. All right. So kind of similar to what we were just talking about, what is missing or could be improved? And then do you have any additional topic suggestions? And over on the right, these are things that people noted in their survey responses. So statistical methods, like more advanced analyses info and examples, and cluster protocols for specific birth defects, HL7 standards and interoperability, remote access impact on case identification, how to incorporate potential data sources, stillbirth and non-live born reporting guidance. Again, more nuances for passive and active programs and how to transition from passive to active. Codes, how to incorporate CMS coding changes, list of major versus minor defects, and syndromic classification. I think that is the syndromic classification would be interesting because I think that's something that work groups may have looked at in the past, but how to incorporate that into our guidance or doing that in some way, be it in the guidance itself or with references to other documentation, I think would be helpful. Let's see, birth defect surveillance in a post-Roe world, how to gain access to data, and how to advocate in a politically conservative climate, things to be aware of, those sorts of things. So that's, those are kind of the things that we got back from the survey. And let me go.
On the topic of birth defect surveillance in a post-Roe world, several of us are actually working on drafting an editorial or commentary for birth defects research on that topic. I have a feeling, though, that the situation is evolving really rapidly. But in any event, that may be a topic where you don't want to wait for the guidelines revision to actually address, you know.
Yes, totally agree. And that might also, I think, rapidly evolving topics like that, there could be places where rather than writing up the guidelines to reflect those things, we have resources available or made available rather than like static guidelines per se. So maybe we reference other places that are updating that information at a rapid pace. Any other thoughts on things that are missing or could be improved or other topics?
I think one thing that I noticed, very minor when going through, was the citations lists in each of the chapters, and many of them are a bit dated at this point from the 90s for a lot of them. And so I think that one exercise that could be helpful is just going through the publications list on NBDPN website. We have a great list of multi-collaborative projects and the publications that have come out of those. And so we could kind of look there for a starting point to see what is current and what has been published recently, that and kind of triage to see what's relevant to the content in the guidelines.
Yeah, definitely.
I had something too.
Yeah.
I was wondering if we could have improved guidelines specific to some of the newer prenatal testing, like will you take NIPT, that kind of thing. And also for syndromes, like if you have something that looks like trisomy 13, but you don't have a karyotype. Because right now we're doing this a lot by what our clinical geneticist says. And you know, if it kind of looks like a syndrome, she takes it. But some more guidance on when you can say it's confirmed versus just possible might be helpful.
Yeah, that's a really good point too. And I know that's also an area that has evolved a lot since these guidelines were first developed, is that genetic testing. So
Exactly. And we just did,
Yeah.
and a number of us here just worked on the Turner syndrome project where that was a big issue. You had to try and take out the ones that had the wrong kind of prenatal testing. And we had to wound up doing it by hand.
Mhm.
Because
Yep.
it was not fun.
Yes.
This is Carol from Colorado again. One thing that I found challenging is, and it's still a challenge, I think, to make the guidelines a little bit more interactive, meaning less text and more kind of like attachments that can be easily updated, but also to use the technical tools that we've already developed and that are actually in the members only section. And that is where the challenge is, because it is in the members only section, whereas the guidelines are kind of like in the public area. So, you know, those two areas are, I mean, it seemed like I was always having to jump around and giving my staff little areas to also look here, especially for abstracting guidelines and other types of timely issues that become part of the webinars and the learning sessions.
Yeah, that's a good thing to note too, is, you know, just we have all of these great tools that we've developed. And we do, you know, a lot of these things we promote as a member benefit, but there is, you know, there might be stuff that's duplicated in different places where we can kind of condense and put everything in one place so people aren't having to go back and forth and that sort of thing. So that is a good suggestion too. See, I also see a few things in the chat. Let's see, Simon asked, in what ways do the upcoming revised guidelines aim to address health disparities and promote equity in birth defect prevention? And that's a good question and something that we'll definitely want to think about as we go forward with our revisions. Let's see, so some other comments about prenatal reports, guidelines specific to gender assignment for those with and without chromosome analysis and how to report that. A note that things are also getting complicated by testing that goes out to out-of-state labs. And yes, that is certainly, but for some states, probably for a lot of the smaller states, I could see that being an issue too, is how do you get that information? And Dominique noted cross-state information sharing is a bigger issue to think about. Vitals manages to do this, so there has to be a way. Yeah, and that is something we could consider too for guidance on. I know the legislation section in particular wasn't super helpful for people. I think it's probably one of those things that you read once and then you don't need to reference it often after that, but we do want to have a place for some of those resources. And in that we could include some guidance on how states can work together to do some of that cross-state information and data sharing. And you know, I don't know if we know all the answers necessarily, and every state is a little bit different, but we could certainly try to get some examples. Let's see, better and more timely tracking of CMS coding changes. Yes, that is something that I think we try to keep up with, but it's not always because of how the guidelines are put together. We will update, we can update appendices as we need to, but I think all of that stuff is kind of in different places on our website now. So again, kind of trying to get our resources all in one place or put together in a way that's easier for people to access. Any other comments on these couple questions? All right. So do you have suggestions for increasing the utility of the guidelines, and what would make the guidelines more relevant for your use? And we've talked about, I think, a few of these things already. And over on the right, again, we've put some of the responses from the survey. So I think folks are noted increased awareness of the guidelines. So that is something that we can think about how to do as a network. Separate from revising the guidelines themselves, is just making sure people know about them and where to find them and all of that. And then let's see, so having a complete manual available for download. Let's see, one large file and printing PDFs as subsets of the full file, so everything can consistently be updated as updates are available. And I think we kind of have it like that right now, but it's, I think some appendices are updated more than others. So I think once we have things kind of in a leaner and meaner format, hopefully that would be easier to do. And then just kind of comments related to having the guidelines be more interactive. So with hyperlinks and that sort of thing, condensing materials, more visuals, tables and cheat sheets, and less just straight up text. And then further code breakdowns in Appendix 3.1, or what is currently Appendix 3.1. Coding examples in a statistical method section. Some guidance on IT technology and automated procedures that are practical, useful, sustainable, and within reach. That's a great suggestion. Guidance on how to group different types of birth defects for statistical analyses. And then again, acknowledging the different levels of programs and how different information applies. So active, hybrid, passive. So those were kind of the things we initially got out of the survey, but would love to hear any additional thoughts. And Irini noted in the chat, guidance on new genetic tests as they become available would be useful. So yes, I totally agree. And kind of formatting the guidelines in a way where different sections are easier to update over time, I think would be helpful too, so that we could make those changes as they occur instead of, having to go through in one big swoop many years later. Other suggestions or thoughts on what would make the guidelines more relevant?
Hi, this is Stefan. Can you hear me?
Yes.
Okay, hi. Yeah, thank you for doing this. And I suggest this is a lot of information and data, perhaps breaking this information down into sections and allowing people to form committees to tackle different subjects.
Yes. Yeah, and that I think, again, we're still kind of in the planning phase at this point. But the work group has talked a little bit about how to move this process forward and to actually tackle the revisions. And that is the idea, is that we would have kind of smaller subgroups where people are working on those specific chapters. So we've proposed, I believe, 7 chapters, and perhaps we would have like a small group working on each chapter separately and contributing to that specific content. And we probably won't get it all done at once because it is a lot, and we rely on you all as the network members and volunteers to help with these things. So it might be that we take a look at what we're proposing for the first, 3 chapters or 2 chapters, and try to create some subgroups around those and get those moving, and then kind of move along from there. So yeah, that's a good point. Any other suggestions or thoughts on these items? Right. So I think this is our last, this is our last slide. So the last kind of questions we had, first of all, what kind of a format would be most helpful and user-friendly for you all? And then just wanted to open it up to any other suggestions or guidance as well. Some of the suggestions that we received from this survey were to try and make the guidelines more abstractor friendly. And I wish I knew who had given that bit of feedback, because I would love to have more on that. One of the, I think I mentioned earlier in the survey, space was limited for the responses, so they had to be short. And one of the reasons we wanted to have this listening session was so we could get some more broad responses from folks and go a little deeper. So I would love to hear more about what might make the guidelines more abstractor friendly. And then again, acknowledging information for passive versus active programs. Having contacts provided for certain sections, that's a great suggestion. One thing we would have to do is just make sure to keep things up to date if we were to do that. But there might be specific sections where that does make sense. See, shorten the overall volume of information to make it less overwhelming, and that is definitely something we are aiming to do. Adding some statistical concepts, redefining certain language, like around sensitivity and specificity. And then we also received some gratitude and support for revising the guidelines, which is great. But would love to hear more about what for you all would make the guidelines more usable.
Well, I'll jump in, Rebecca from Massachusetts. A couple of the hardest things that I have to deal with are the fact that these are tall data sets, and I need to go from individual BPA codes into, a collection of defects of interest, spina bifida, the atrioventricular septal defect, and some way of providing mapping and code could be helpful there maybe. The other thing I do a lot that might be useful for the statistical concepts to get more specific than just that is I calculate 95% confidence intervals for prevalence a lot, and then maybe having some information on how you would compare.
Yeah,
to
those are
changes and differences.
Yeah, those are great suggestions. And those are things that I do a lot as well within my program. And I think it would be really helpful to have probably some like code examples would be really helpful for those things, because I bet a lot of programs do those types of activities all the time. So
that and then the tall to wide problem, because I've had some data requests that require line level data and they want the defects strung out for individual records versus working with tall data. If you're doing prevalence for a group at a time, then you want to keep them all together, but you have to be careful about the deduplication that you're not double counting people.
Yes. Yes, this comes up for me every time I do a data request pretty much. So yes, our data is kept wide. And so I'm going wide to long a lot of the time, but being able to go back and forth without, duplicating or losing information, kind of tips and tricks for that would be helpful. Agreed.
I would volunteer to get with you because we keep our data tall.
That's funny.
So I'm going tall to wide. So I can help you with the code for how I do that. And maybe you can help me with the code on going the other way.
Definitely. See, and I see in the chat agreement that coding examples would be very helpful. And then Irini noted that perhaps each chapter could start with the main points and what it would be helpful for. So having like a very brief, perhaps even like bullet pointed overview at the beginning of each chapter. It's a good suggestion. In terms of accessibility, what I think right now we have, it's all kind of PDFs, and I think you can pull up chapter specific PDFs and also a PDF of the full manual. But does that, but it seems like maybe that's not interactive enough for folks. Do you want more like hyperlinks and that sort of thing? Would that be helpful?
I think the hyperlinks need to be within the content of the narrative itself, so that, again, it prevents the bouncing around and not having to have a whole bunch of information saved as.
Mm-hmm.
The other area, and when we look at the master table of contents, to kind of plan ahead and to incorporate the emerging technologies that we don't even know about, but will there be a place? And I'm thinking of the SNOMED classification system with interoperability, and even interoperability and the HL7 standards. Where would they fit even as an appendix? And so these emerging technologies, we just need to make sure there's going to be a place for them without us having to revise an entire guidelines manual again.
Yes. Yeah, that's a really good point, and why I think having those links within content would be helpful, so that as those things are updated over time, there's still a way to get to them through the guidelines without having to go through and necessarily revise the guidelines themselves constantly. So I think part of the process will be kind of in addition to just revising kind of how the guidelines are written, also kind of curating what information is out there within the network, and also from our partner organizations like CDC and others. Could we link to the information that they're providing and updating?
And just because I had already forgotten, sorry, what the existing guidelines said about calculating confidence intervals. They talk about doing it by hand, and nobody's doing that.
Right.
So sharing code for that, or at least I hope nobody's doing that. That's pretty tedious. So sharing some code there would be really helpful. I mean,
Yeah.
Sure, fine, have how it's done, but it says use the Poisson distribution and it has it there, but like we had somebody write us a very nice macro. So I don't go back to I don't go back and calculate anything. I run it through my handy dandy macro code.
Yes. Yeah, and a lot of us probably have those same kind of procedures that we run over and over. And so code examples for those would be great to include. I also see a suggestion in the chat for coding examples for data quality checks, which is a great suggestion as well. So could perhaps check key data fields for values that seem likely to be inaccurate, for instance. So yeah, that's a great suggestion. And we do have some data quality guidance in our guidelines that we want to carry forward into the revision. And so having coding examples for how to do those checks, I think would be pretty helpful. And then Laura noted that CSTE has a surveillance toolkit that's online that has some of the structure folks are talking about. So that could be a resource that we look at for some inspiration. That's really helpful. Thank you, Laura. Let's see. And then, yeah, so Rebecca in Massachusetts noted they have a lot of code for doing just that. So both internal checks for missing or illogical values and for comparing surveillance data to live birth certificate or fetal death certificate data. And that's another thing I wanted to note. One of the reasons why we wanted to kind of get a sense for how folks are using the guidelines and kind of what they might find helpful is that a lot of us are doing some of these things already. And so we don't necessarily need to reinvent the wheel when we do these revisions. We have a lot of resources kind of among our programs already. So part of this process will just be figuring out how to kind of curate that information that's already out there into a place that we can all get to easily.
Simply defining certain things would help. I remember seeing somewhere, I think it was in the guidelines, that the NBDPN recommends, what is it? Reabstraction as a form of quality control, but it doesn't define what that means or how exactly you do that, or what percentage or number of cases you would check, there's a big gap between the just saying reabstraction and actually trying to implement a protocol for reabstraction, as we found when we tried to do just that. So, I mean, does it mean check every single field? Does it mean go back and hand review records? What does it mean? And like for abstractors comparing each other, and maybe it doesn't have to be like a how-to, but it could be here are how some programs do it, but this is what we mean by that, by reabstraction.
Yeah, that's a good point. And I think having more examples would probably be helpful. I know for me, that tends to be like how I learn is like, I need to see an example and then I'll get it. But yeah, so making sure we have definitions for terms like that we're using, and then also some examples for how those things can be done. And maybe not all programs are going to be able to follow those examples, verbatim, but it's at least a place to start. And I see Dominique noted 100%. I need examples to understand. Yes, ditto. So yeah, I think including more of those things would be helpful. And we have just a few minutes left in our session. Any other suggestions?
Maybe some sort of mentorship ideas, maybe. So like states that do active surveillance and have been doing it for a while could mentor states who want to move in that direction. So when it says contacts provided, I assume that's what you're talking about, or contacts provided for certain sections, or maybe contacts provided for maybe setting up mentorship arrangements. So passive states just starting up a birth defects program for the first time, or wanting to expand.
Yeah,
in different directions. Have actual, contact people.
Yes, and for those states too that are thinking about, maybe they're a passive state and they want to be more hybrid or active. So maybe knowing what other states have done that and gone through that process that they could reach out to, that would be helpful. And some of that information we kind of have in our directory right now, but it's all state by state. So finding some way to make that a little easier to interpret.
If it's possible to have the directory in a spreadsheet format, that would be amazing. Because then we could sort and organize and see who checks off what boxes.
Yep. Yeah, that's certainly something that we could consider. Let's see. And then let's see. So maybe also explanation on the different surveys on data quality that are used by the network. Yes, that's a really good point too. So we have some tools that we've developed that definitely we could link to in the guidelines and make that connection between the guidelines and the data standards and tools more apparent. All right. And then I see lessons learned too. That is always helpful. Okay, so we have just a minute left. So I think, Justin, did you have a couple of updates that you wanted to share with the group before we wrap up?
Sure, I can. On behalf of these are more related to the NBDPN conference that's happening later this year in August. So on behalf of that planning group, I just wanted to remind folks that the poster proposal deadline has been extended to June 2nd. I have a bunch of links that I'm going to drop in the chat so that you can copy them real quick or click and bookmark or something if you need to. So posters are still being accepted for the conference. I think there's an additional deadline of when to upload the PDF if you would like to be part of the poster judging for poster awards. And then there are also these 3 links here for the different conference awards that will be given out at the conference. Russ, if you want to say anything, you're welcome to.
Yeah,
that.
all I would say about that is we really would like to encourage particularly nominations from states. We have 2 different state awards. None of these awards have been given out for 3 years. So we'd love to hear, if your state is doing something you think is really innovative, we'd like to hear about it. So take a look. I think Justin's going to put links so that you can see where the information about the awards is. But we would really love to have a hard time choosing who we want to give the awards to. But the more nominations we get, the better. And
Yes.
nominations are very much encouraged.
Definitely. And I do see Justin put those in the chat. So please do take a look and give that some consideration. And we are out of time for our session today. But hopefully many of you will be at the conference in August, and looking forward to further discussion on these guidelines as we move forward. And hopefully also that you all will consider being a part of that revision process when we move forward on those chapter specific groups. So thanks for sharing your feedback today and for joining our listening session. And we appreciate all of your feedback. Thank you.
Thank you.
Yeah, this was great. And I've been taking down all sorts of notes and comments, and they will all be considered. And
Yes.
there'll be opportunities for a lot of you to help out as well. It's
Yes,
going to be a big
definitely.
group.
We would love for you all to help out.
Yeah.
So you'll be hearing more information in the near future. Thanks.